Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we've just done a video on a case where both lower second bicuspids were missing, and so it was an adult, and we just extracted the teeth and started doing the orthodontics as he was earlier or further along, and all the teeth were in, so we didn't need to section the deciduous second molar to allow this drifting without the tooth above dropping down. But in this one, we figured we'd better go ahead and section it, so we did. And let's get into that right quick, and I'll show it to you. It's just where you got one second molar, second bicuspid missing, and we're going to use the wisdom tooth on that side to close the space. And let's get on here. It's a nice young lady who she looks kind of sleepy right there in that deal, but here she's brightened up quite a bit. And I'm going to run through the teeth, and then I'll go through the x-rays and show it. She's got some orthodontic problems in here, and where we took that section, that tooth. I'll show you in just a minute here. All right, things aren't exactly up and up all over the mouth, so we're going to have to do some regular orthodontics. That's happens all the time, and so we'll start out by just straightening the teeth out, and then we'll wait. Now she's missing this tooth on the right side over here. That's the one that's missing. Let me get my little arrow going here so I can draw. So here this lower second bicuspid is missing there, and the other one is apparently in there. Now here's a good x-ray, and this was taken when she was age 6 and 4. Now, that's just a little past 6 years of age, and you can see all the baby teeth and everything in there, and she had a crowded lower anterior, so we cut these deciduous cuspids down and did the pulpotomies on both of them and made room and let those teeth straighten out down here on the bottom. And now, coming along, she's going to be missing this lower second bicuspid. Here's the lateral that's coming in here, a permanent lateral coming in. Here's the cuspid, here's the first bi, and we can see this one is absolutely gone. It's just, well, it just never formed. And over here we've got one, and so we're going to keep this side and take this tooth out eventually and drift this and see if we'll wait to see if she's got a wisdom tooth back here. So we did the slicing technique down here on those lower cuspids, and the pulpotomies there, and here they are. Here's the pulpotomies. It's done there, and let me pause this for a minute. Zoom here. Okay, we come, sorry for that intervention here problem. Now we come back and we see that we could take this out, but to keep this tooth from dropping down, we sectioned it off here and took the tooth, that portion of the tooth out. Let's go now. That's age 8. This is going to take a long time doing this type of. You have a two-phase thing, but you never have a place to stop. So it's just a long, drawn-out procedure. So we take the distal, part of that out, and this keeps this tooth up here, and we're going to let this molar drift over into this space right here. And she's 6 and 6 months and the wisdom tooth is forming. She's got one back there, and there will be one up here. And this is the one we're going to use. And this one doesn't have room, and this one wouldn't have room, except we're going to move these teeth. I'm sorry, this is the wisdom tooth. Here's the second molar. This will all move up to here. Now, now go ahead and I go to the next x-ray where we took that tooth out, did a pulpotomy on that, and then we'll extract this tooth, and we've drifted. You see, this tooth was really over about this far, and it's drifted that much during that time, and we'll come in and take this piece out right here, and we've got second molars and wisdom teeth up here, second molar and a wisdom tooth, second molar and a wisdom tooth over here, and one over on this side. And this is the one we're going to utilize. And so we get it out, we'll come back, and this is drifted. Now, we haven't done anything much except just let the teeth drift. In other words, we're watching her, we're doing orthodontics here, just letting nature take care of itself, where we go in and remove teeth in the spot where we'll let the teeth drift. Now, this will drift almost parallel, but when we get ready, we'll put a little of that down bend on it, raise it up and tie it, and it'll bring these roots down in that parallel fashion. Now, on the other side of the mouth, the wisdom teeth are coming in, but we're not going to have room for them. The bone structure on this young lady is going right up here, and there was no way we could, if you left that wisdom tooth, you'd lose it. So we used it rather than waiting and losing that and taking the wisdom tooth and putting a bridge in there or the implant or whatever you wanted to do with it. We drifted, and I even called this driftodontics one time. We didn't really get in there and get to work on it until they were a lot older. She's 8 and 1 month right now at that, and now we were together here, and we'll continue to put a little pressure and bring these roots up. And over here, the wisdom teeth have no room, and this one won't have any room either. And we'll drag this tooth up and close that, and it'll probably come out like that. And so we recommended removing the wisdom teeth, maybe not at this particular time, but we'll do it later on down the line. Now, the young lady is 13 years and 10 months, and we're just now getting going with the orthodontics, you see. But this is a long-term thing where you watch this. Students in school can't mess with people like this. I mean, they don't have 6 or 8 years to watch somebody like that. Now, she's age 13 and 10 months, and we started when she was 6 years old, seeing what we would have to do this case. And this is what I want to stress for you. Pediatric dentists or any dentist working on children should learn how to do these things, because you can't send them to an orthodontist 2 or 3 times during that period of time. Now, if you've got 3 or 4 pediatric dentists working in a clinic, and they can hire an orthodontist to come in, but the orthodontist won't know how to deal with the children unless he's studied some pediatric type orthodontics here. So I'm not trying to down anybody. Maybe you learn this in orthodontic school, but I don't think there's very many that teach it. So here we pull that tooth on up. You see it's getting straighter, and this is working all right. And now we're going to let this tooth come up in and work on there. And then we'll get those 3 wisdom teeth extracted. Let's go on to the next view now. And this is the young lady is 15 years old, and 15 and a half just about. And this tooth, we've got to get it up in here. Now if we take these braces off, we're going to have to put something under this tooth, just kind of run the edge of the retainer on it to hold it up. But let's see whether I've got another x-ray in here or not. She's 15 and a half years old, and we'll go, and I have a hard time following these young people, and they get grown like that, to get them back to look at that, but I didn't have it. So I'm going to just run through the what we did here in the, some of this drifted over there, and there's the space. And here we're waiting on the second bie over here, and this one is missing. And you will see this molar here will have the two bies and the cuspid. This will have the cuspid and one, well, let's see, the cuspid and one bie, and it'll, but we'll save the wisdom tooth on that side. And now that's brought up. And here it is, 1993, 93, and we've got those teeth together. And we'll close that space. And so this wisdom tooth back up here, we can't see it, but we'll have room for it. We get this jammed up here good and close. And here is the young lady. We got her back and finished this up, but I didn't get any more panorexes on it. So I'm sorry for that. And I hope you realize what we're doing here. This closed up, so your wisdom tooth, we saved it and used it to fill this space up right there. And so I'm going to say goodbye for this evening, and I hope you get something from that. We've shown you somebody who was missing 2 lower second bies, and then somebody's missing 1 second bie. And we saved the wisdom tooth in all these cases. Now, if they hadn't had wisdom teeth, we'd have maybe done something else. But they did have the wisdom teeth. Thanks again for watching. I hope you will join our group and subscribe to it. And we're going to try to cover everything that you might run into in doing orthodontics, the pediatric type and the adult orthodontics, which I don't think is being taught in very many orthodontic schools. So thank you again, and I'm going to sign off and say good night. Bye-bye.